This video introduces our latest work, Systematic Evaluation of Hip Exoskeleton Assistance Parameters for Enhancing Gait Stability During Ground Slip Perturbations. As we age, changes in our cognitive and musculoskeletal function can limit our ability to effectively respond to disturbances in stability during walking, such as a slippery walking surface, increasing our overall risk of falls. As a result, falls are a leading cause of injury and injury-related mortality for adults over the age of 65. Mobility aids such as walkers are often prescribed to older adults to improve their safety and independence during daily walking activities. However, these devices require careful user attention and proper placement to be effective, which is often impaired during perturbation, especially for older adults. Wearable robotic lower limb exoskeletons are a promising alternative to traditional mobility aids. With onboard sensing and actuators, these devices can detect instability in the user and provide assistive torque at the lower limb joints to improve stability during walking. While recent studies have started to explore applications of exoskeletons to stability outcomes, there is still a large knowledge gap in understanding how the assistance parameters, such as the magnitude and duration of torque assistance, will directly impact stability, especially during walking perturbations. To address this, we conducted a study using a bilateral hip exoskeleton and modulated the duration and magnitude of hip exoskeleton assistance during a slip perturbation to walking. Using whole body angular momentum as our main outcome measure, we hypothesized that as assistance magnitude increased, we would see a decrease in the overall whole body angular momentum range, indicating an increase in stability. We also hypothesized that the optimal duration would align with the natural biological flexion response that we observed during the perturbation, given that we'd want to support rather than completely override the user's response. Additionally, we included a previously validated baseline controller in this study, which was designed for improving energetics during steady-state walking. We compared this controller's performance to the best performing assistance parameters per subject, meaning the parameters that most reduce whole body angular momentum range. Given that the majority of existing hip exoskeleton controllers have been optimized for energetics rather than stability, we wanted to understand how these existing controllers might perform during destabilizing situations such as a slip perturbation. 8 healthy adult participants experienced anterior-posterior slip perturbations while walking on a split belt instrumented treadmill. In addition to randomizing the perturbation onset and side, participants also wore a set of special peripheral blocking glasses and noise-canceling headphones to reduce anticipation of the perturbation event. During each trial, subjects received one of 28 exoskeleton assistance conditions during the perturbation. This included 25 combinations of magnitude and duration for a simple trapezoid profile, a no exoskeleton assistance in which the device was not worn, a no assistance condition where the device was worn but turned off, and the previously mentioned energetics baseline controller. We used a markerless motion capture system to collect the kinematics information necessary for post-hoc calculation of whole body angular momentum range. We found that the duration of exoskeleton assistance directly modulated the impact that assistance magnitude had on whole body angular momentum range. Contrary to our original hypothesis, we found that at short durations of exoskeleton assistance, increasing assistance magnitude had a destabilizing effect compared to not wearing the device at all during the perturbation. However, as we increased the duration of assistance, the effective magnitude became non-significant, and we began to see improvement in stability compared to not wearing the exoskeleton. We observed high intra-subject variability in the whole body angular momentum response to changes in assistance duration and magnitude. This aligns with the findings of previous studies focused on energetic outcomes and further emphasizes the need for personalized exoskeleton assistance that's tailored to individual user needs. We used interpolation to estimate the whole body angular momentum response between the discretely sampled experimental parameters. The interpolated surface map further emphasizes the importance of tuning the temporal parameters to move assistance from being destabilizing to improving stability. Differences between the sampled data experimental minimum and the theoretical optimal of the surface further highlight the need for personalization to specific users. In alignment with our sub-hypothesis, we found significant improvement in stability for the best performing parameters per subject when compared to no exoskeleton, no assistance, and to the baseline energetics optimized controller. Specifically, compared to the baseline, we saw a 25.7% reduction in whole body angular momentum range. Overall, these findings highlight the need for stability-specific controller optimization with a specific focus on temporal parameters. Furthermore, they highlight the need for subject-specific personalization of stability assistance.